This is part 22 of our emergencies in first aid playlist, and we'll talk about burns and scalds. Burns and scalds are tissue injuries which are caused by heat or thermal energy. Okay. It not only that, they can also be caused by electrical energy and also chemical agents. Burn is injury that is produced by dry heat, for example, fire or electric shock, while scald is injury that is produced by most heat, for example, boiling water or steam like that. What is the aim of first aid when dealing with people who have got burns or scalds? You want to prevent further damage by removing or extinguishing the source of injury. What has made this to happen? So you want to stop that. If there is a fire, put out the fire. If there's an electric shock, you want to switch off the power supplies. If there's boiling water, you want to make sure that you remove that. You also want to prevent further damage by correct management of the burn. Very important there. Okay. You also want to prevent infection, also to minimize the effect of loss of fluid from the tissue, because when there is a burn actually like that, fluid can be lost from tissue. You want also to minimize fear and to reassure the victim. Don't tell you actually you are dead. You by the time we reach here, I don't think you survive. Your aim is to minimize fear and to reassure the victim, and also to ensure that there is a swift transport to the hospital. As quickly as possible, the victim should be taken to the hospital, right? So, the other thing that you want to do is you need to remove the source, okay, of injury, as we have already said. What can you do then? You can clothe the fire. If you are present when uh, all right. So it is important to remove the source of injury. Imagine someone is putting on clothes. So if you are present when someone's clothes catch fire, make sure you have him roll on the ground to put out the fire. If a blanket or large cloth is available, covering the victim in the blanket will smother the flames. So make sure that if there's a fire on the body, you put it out like that. Okay. So this is what we are talking about. This is a scald. Hot water is burning there and then the water spills on the person like that. So let's talk about how about if there's an electric shock. If possible, you need to make sure that you turn off the source of the current. This is not always possible, and therefore the victim needs to be moved away from the current manually. Use a stick or other non-conductor to push the victim away from the source. Do not touch the victim direct or you'll be electrocuted and you end up also in the same position as a victim. Okay. How about if it is there are chemicals which have caused these burns or scars? Chemicals will continue to burn the skin as long as they are left in contact with it. So what you want to do is you want to flush the burn under running water for at least 10 minutes. Take care of to flush the chemical so that it does not contaminate and burn other areas of the skin. You know, there are some chemicals immediately you put them on the skin, they feel like you are burning like that, all right? So this is what you want to do. So correct management of burns. Burns are actually going to be classified into two ways: the depth of the burn and also the area of skin burn. When we're talking about the depth, you have got first degree. This one is going to result from overexposure to the sun, light contact with hot objects, for example, iron or hot pot, or scalding by hot water or steam. It involves the superficial layer of the epidermis. So first degree burn will involve basically the superficial layer of the epidermis of the skin. What will be some of the signs and symptoms? That is a first degree burn, redness or discoloration or discoloration. There's also going to be mild swelling and pain. It's mild. No blisters are going to be formed for first degree burns. There's also going to be rapid healing, heals within 1 to 2 weeks. How do you get to treat first degree burns? You apply cold water or submerge the burnt area in cold water. Apply a dry dressing if necessary. Do not apply ointments. All right. Don't start applying some oil or some Vaseline or something like that. That will retain the heat. Instead of the heat moving away, the heat will still be there on the portion that has been bent. Okay. So this is the first degree, as we can see. It's only the superficial layer that has been bent. You can see for the second degree that there is actually some blisters which you are able to see. And then for third degree, the entire skin has been taken and you're also going into the penetrating tissue there. All right. So second degree results from a very deep sunburn, contact with hot liquids and flash burns from gasoline, that is the petrol and these other things, kerosene and other products. This one is going to destroy the epidermis and is going to involve the upper layer of the dermis. In other words, then all the 4 or 5 layers of the skin are going to be destroyed. The stratum lucidum, the stratum corneum, the stratum basal, or the stratum granulosum, all those, the stratum spinosum, they're also going to be destroyed. And you go also into the epidermis, I mean the dermis. What are the signs and symptoms that someone has got second degree burn? You are going to see red or mottled appearance, development of blisters because the plasma seeps into the top layer of the skin, raising it up to form a blister. So second degree, you are going to see blisters. Considerable swelling over a period of several days is swelling after a lot of days. Wet appearance of the surface of the skin due to the loss of plasma through the damaged layer of the skin. So it's going to be wet appearance. There's also going to be severe pain as the nerve endings will have been irritated, but they will not be destroyed. And this will heal like in 2 to 3 weeks, 14 to 21 days. How do you treat a second degree burn? Immerse the burnt part in cold water. The water shouldn't be iced until pain subsides, or apply cold wet clothes. Apply a dry dressing. All right. Do not break blisters or remove damaged tissue or bent clothes. Okay. So anything that has been damaged, don't remove it. Blisters, don't break them. And also bent clothes, you are supposed to don't remove them actually. So both intact skin and bent clothings, these are going to act as a sterile dressing. Breaking the blister leads to a point of entry for bacteria. And also the bent clothings, those are going to also act as a sterile dressing to prevent the entry of these harmful substances. So you don't want to remove them. Keep the affected area elevated to reduce swelling. Keep the victim lying down and quiet, and also give them an assurance. Okay, reassure them. Also have third degree burns. Now the third degree burns, there is total skin loss, and is going to be mostly caused by flame, ignited clothing, emission. Someone has been immersed in hot water, contact with hot objects or electricity, contact with corrosive chemicals. The signs and symptoms that someone has got a third degree burn, you are going to be able to see the loss. Okay, there's going to be actually deep tissue destruction. So this is going to involve all the dermis and the underlying structures are going to be destroyed, as you saw on that picture. It goes much deeper. White or child appearance. At first, a burn may resemble a second degree burn, right? The burns may be less painful as there is destruction of the nerve endings. So the nerve endings have been destroyed. So pain is going to be limited to the edge of the burn where the nerve endings are still intact. Otherwise, it might be almost painless. You can't feel any pain because the nerves have been destroyed. Signs and symptoms continued here. There's going to be loss of plasma. Okay, loss of plasma into the tissues around the damaged capillaries, and that is going to lead to edema because the capillaries which are around, they are losing plasma. So that plasma is going to the tissues around, and then they end up to swell. Someone has now edema. The edema increases the local tension, applying pressure to the local capillaries. Okay, when you do apply pressure to the local capillaries and further reducing the blood flow to the area. So edema increases the local tension, applying pressure to the local capillaries and further reducing the blood flow to the area. This is what is happening. Look at this. Edema is where you are getting to swell. So that swelling is actually increasing tension, all right? And that tension is more applying a pressure on the capillaries. The capillaries are getting, the capillaries are getting to be more compressed. And if they're compressed, that means that even the little blood they're supposed to deliver is all going to be reduced like that. Okay. And that is going to lead to necrosis. There's going to be tissue destruction. So the tissue starts to die like that because there's no blood supply to the area. These burns take months of extensive treatment for healing to take place. They require skin grafts. You can actually transfer some skin, you move skin like that. Okay, how do you get to treat this? So do not immerse an extensive, deeply bent area in water or apply water over it. Okay, cold may intensify the shock reaction. So this is different from secondary and primary degree shocks. This one, the third degree, you don't get to use water. A cold pack may be applied to the face, hand, or feet. Do not remove the stuck particles or card clothes. So what has stuck on the person, don't remove them. And also make sure that you cover burns with a dry dressing. Do not use cotton wool or lint materials as this will stick to the burn and interfere with hospital treatment. Elevate hands, feet, or legs if bent. All right. You want to do that so that you reduce on the loss of plasma like that and the other things. If medical help will not reach the scene for an hour or more, and the victim is conscious and not vomiting, give him water or a weak solution of salt and soda. One level teaspoon salt and half level teaspoon soda to 1 liter water. At home and even in the road, allow the victim to sip slowly. Give 120 ml to an adult, 60 ml to a child, and 30 ml to a baby over a period of 15 minutes. If vomiting is going to start, then stop the process. Okay, you are going to provide immediate transport to the hospital because you want this to be treated as soon as possible. Remember, we said we can classify burns in two ways. So we have classified them depending on how much the burn has gone. You can also classify the burn according to the area of the skin, but not the depth. Okay, so the area of the burn is described as a percentage of the total body surface and is calculated by the rule of nines. Each area of the body is going to represent a multiple of 9. For example, the front of the trunk is actually, you have got 9 on the thoracic region on top there, and then 9 on the abdominal region. And then the hands, starting from the top to the bottom, from the arm, forearm, and the hand, this is representing 4.5 in front, 4.5 as the area in front. Behind it's also 4.5, meaning that the entire upper limb, one of this one, has got an area of 9. In front is 4.5, behind is 4.9. But for the trunk, the entire front is actually 18, behind is also 18. That makes 36 for the trunk. And then for the lower limb, the entire of it is also 9 as the area, and then this is also 9 as the area. Meaning behind is also 9 and also 9, meaning that one leg, okay, starting from the thigh, the leg, and the foot, is going to have an area of 18. And then if you look at this region alone, this is just 1%, that is the area. Okay, so you can actually do calculate how much area has been bent. Say for example, a person has got a bend of the entire front part of the one of the upper limbs, and then the entire head, how much area has been bent like that. So for the front of the upper limb is just 4.5. If it's the entire head is 9%, so add that 9 and 4.5, that will give you the area of the skin that has been burnt in comparison to the total body. Okay, so that is it for this part. In the next part we talk about epilepsy. Thank you so much for watching.